Fatty liver disease. I will give you an overview first, so if you are in a hurry, you can gain some insight. Fatty liver disease, also known as steatosis, is a medical condition characterized by the accumulation of excessive fats within the liver, potentially leading to harm to this vital organ and the onset of severe complications. This condition can be influenced by a variety of factors, including obesity, a high-fat diet, excessive alcohol consumption, and diabetes mellitus. This is often termed NAFLD, meaning non-alcoholic fatty liver disease. This name distinguishes it from the one caused by too much alcohol. That affects people who take little to no alcohol. Too much fat builds up in the liver. It is seen most often in individuals who are overweight. The factors contributing to the development of fatty liver in most cases are family history or genetic predisposition, excess body weight or obesity or higher body mass index, insulin resistance, characterized by reduced sugar uptake by cells in response to the hormone insulin. People who are taking insulin can still develop fatty liver disease. In fact, insulin resistance and type 2 diabetes, for which insulin is often prescribed, are considered risk factors for the development of non-alcoholic fatty liver disease or NAFLD. This can lead to obesity and the accumulation of fat in the liver. According to research, dietary intake of added carbohydrates as well as fats have been shown to have a major role in progression of the disease. They fuel de novo lipogenesis, the conversion of excess carbohydrates into fatty acids. Therefore, individuals taking insulin should be aware of these risks and work with their healthcare providers to manage and reduce the risk of developing NAFLD through lifestyle changes and proper medical management. Type 2 diabetes, also known as high blood sugar or hyperglycemia. Elevated levels of fats, particularly triglycerides, in the bloodstream. These underlying health issues can collectively play a role in the formation of a fatty liver. Nevertheless, it is worth noting that some individuals may develop NAFLD even in the absence of these risk factors. The prevalence of NAFLD is on the rise globally, particularly in wealthy families in the world, as the rates of obesity continue to escalate. It represents the most prevalent form of chronic liver ailment. It affects approximately a quarter of the global population. In the United States, around 100 million people are afflicted by NAFLD. Non-alcoholic fatty liver disease, commonly referred to as NAFLD, is a condition that impacts individuals who consume minimal or no alcohol. It is characterized by the excessive accumulation of fat within the liver and is most frequently observed in individuals who are overweight or obese. Certain individuals with NAFLD may develop non-alcoholic steatohepatitis, also known as NASH, which is a severe variant of fatty liver disease leading to liver inflammation and damage caused by fat deposits. NASH can progress and result in significant liver scarring known as cirrhosis, and in some cases, it may lead to the development of liver cancer. This damage is akin to that caused by excessive alcohol consumption. NAFLD often has no symptoms till it is too late. They may include unusual fatigue and not feeling well, discomfort or uneasiness in the upper right belly area. Possible symptoms of NASH and cirrhosis, or severe scarring, may include shortness of breath, swelling of the legs, itchy skin, abdominal swelling, spider-like blood vessels just beneath the skin's surface, enlarged spleen, red palms, yellowing of the skin and eyes, or jaundice. Individuals affected by fatty liver disease are often advised to consider lifestyle modifications, incorporating changes in dietary habits, regular exercise, and weight management. The liver, a major internal organ situated in the upper right quadrant of the abdomen, serves crucial functions such as detoxifying the body and processing nutrients from ingested food. It plays a pivotal role in filtering blood from the digestive system before distributing it throughout the rest of the body. Fatty liver disease is prevalent in Western countries, afflicting approximately 1 in 10 individuals. While it is typical for the liver to contain a certain amount of fat, once the fat content exceeds 10% of the liver's total weight, a diagnosis of fatty liver is established, raising the likelihood of more severe complications. Fatty liver can remain benign, but in some cases, the excess fat can trigger liver inflammation, a condition referred to as steatohepatitis. It is important to distinguish between alcoholic steatohepatitis, which is linked to alcohol abuse, and non-alcoholic steatohepatitis, NASH, which is not alcohol-related. Prolonged inflammation may result in liver scarring and hardening, a critical condition known as cirrhosis, often leading to liver failure. NASH is recognized as one of the top 3 underlying causes of cirrhosis. The causes of fatty liver disease primarily revolve around the excessive consumption of calories, leading to the accumulation of fat in liver cells. In situations where the liver cannot adequately process and metabolize fats, fat buildup ensues. Specific conditions, including obesity, diabetes, and elevated triglyceride levels, increase the propensity for developing fatty liver. Additionally, excessive alcohol intake, rapid weight loss, and malnutrition can contribute to this condition, although some individuals may develop fatty liver without exhibiting any of these risk factors. Notably, many researchers propose a connection between fatty liver and metabolic syndrome, a combination of disorders that heighten the risk of diabetes, heart disease, and stroke. Key indicators of metabolic syndrome include obesity, particularly in the abdominal area, high blood pressure, abnormal cholesterol levels, insulin resistance, and disturbances in blood sugar regulation. Insulin resistance is believed to be a crucial trigger for NASH development. Given its potential to remain stable for extended periods with minimal symptoms, some researchers posit that a second hit to the liver, such as a bacterial infection or hormonal anomaly, may eventually lead to cirrhosis. The exact mechanism underlying the onset of a fatty liver is not entirely clear. It could involve fat from other areas of the body or a heightened absorption of fat from the intestine by the liver. Another hypothesis is that the liver loses its capacity to convert fat into a form that can be efficiently eliminated. Importantly, the consumption of fatty foods alone is insufficient to induce a fatty liver. Fatty liver disease typically does not manifest with noticeable symptoms, often only coming to light during medical assessments conducted for unrelated reasons. NASH, in particular, can inflict gradual harm on the liver over years or even decades without causing any overt symptoms. As the condition progresses, patients may experience symptoms like fatigue, weight loss, abdominal discomfort, weakness, and confusion. Diagnosing fatty liver disease often begins with routine medical examinations. A physician may detect anomalies in blood test results or note a slight enlargement of the liver during a regular checkup, which could signal the presence of a fatty liver. To rule out other liver disorders, additional tests may be necessary, including liver function tests, ultrasound, computed tomography, CORT, scans, or magnetic resonance imaging, MRI. Ultimately, a liver biopsy, involving the extraction of a liver tissue sample for microscopic examination, is the definitive method for confirming NASH. Once diagnosed with fatty liver or NASH, individuals commonly have questions for their healthcare providers. These questions may address the potential causes of their fatty liver, the likelihood of developing NASH or cirrhosis, weight management strategies, medication recommendations for controlling cholesterol and triglyceride levels, and substances or activities to avoid to safeguard their liver health. While there are currently no specific medical or surgical treatments for fatty liver, several preventive and ameliorative measures can be employed to mitigate damage. Individuals with fatty liver, particularly NASH, are typically advised to safely and gradually lose weight, often aiming for a modest reduction of 0.5 to 1 kilogram, 1 to 2 pounds, per week. Manage triglyceride levels through dietary adjustments, medications, or a combination of both. Abstain from excessive alcohol consumption. Effectively control diabetes, if present. Adopt a balanced and nutritious diet. Increase physical activity through regular exercise. Maintain regular checkups with a liver care specialist. Ongoing research efforts are actively exploring potential treatments for fatty liver disease. Scientists are investigating various medications, including novel diabetes medications like metformin, pioglitazone, rosiglitazone, and betaine, to alleviate liver inflammation. Furthermore, the drug orlistat, Xenical, designed to hinder the absorption of dietary fat, is being examined for its potential to reduce fat accumulation in the liver, with early results showing promise. If you learned something, please give me a thumbs up. Thanks very much for watching.